dental implants, the cost. Lots of questions about cost. We get emails about the cost. So what affects the cost of a dental implant procedure?
There are many factors that determine the cost of dental implants. I have a list here of about 9 different things that I've come up with that affect largely the cost of dental implants. So the first thing that affects the cost of dental implants for the patient is the actual implant itself, the titanium screw that goes in the jaw. That dental implant, it ranges depending on
how much are they?
Between $300 and $400 a piece.
Okay.
That's kind of the general rule of thumb for what it is that we're utilizing.
Up to about how much at the high end?
High end up to $1,000.
Okay.
Okay. Most are about $300-400. And then there are some for very specific instances that can cost up to $10,000 for me, the doctor, placing those implants. So that's why, you know, when you see on Google or on Facebook, TV, anywhere where there's another doctor saying, you know, dental implants for $1,000, it might be a little bit misleading for the patient.
Because they're quoting the little screw.
That's right. That's what they're talking about. They're talking about the screw itself. They're not talking about the patient getting that dental implant placed into their jawbone.
Now, does that frustrate you as a dentist when you see this on Google?
Oh, it's so frustrating because it's not 100% honest in my opinion.
Okay.
You know, it's not what the patient is led to believe. The next thing that affects cost is the doctors that are involved. Like we talked about before, in a person that's going to get an all new set of teeth on dental implants, fixed on dental implants, that person, you know, traditionally is going to see 3 or 4 different doctors. When you come to see me, you're only going to be seen
just one doctor.
Just one doctor.
So it's less.
Yeah, you only have one doctor to pay, so it's going to be much less. The next thing, you know, is surgery needed. So depending on the type of surgery for these patients, it can vary. You know, some surgeries are easier, quicker, so they're less expensive than other
like
surgeries.
Some people need bone?
Some people need bone grafting.
Lots of other stuff.
You know, it used to be the traditional ways. You had to do a bunch of extractions and then grafting, wait 2 years, go back and then place your implant. And now, with new technology, with the new dental implants, we're able to extract those teeth, place the implants that same day with very minimal bone grafting.
So it's less expensive.
Way less expensive.
To do it that way. Okay.
Yeah, way, because bone graft is very expensive. You know, we were talking about the dental implants, the little screws. The bone graft is 2 to 3 times as expensive for the dentist.
So today, I mean, with your imaging and things, it's very little bone grafting.
Very little bone grafting.
Okay, good.
And with the new surgical techniques that we have.
What else affects the cost?
The next thing is the big lab bill. I don't have the big lab bill because I have the lab in my office. What does that mean? What is the lab bill? The lab bill is, you know, the bill that we get for actually fabricating those teeth. Those teeth that are in that patient's mouth. Somewhere it has to be made, right? In traditional surgery or placement of these types of teeth, there's an outside lab. And in my office, the lab is in the office. We control the costs, we control everything associated. So we can keep it a little less expensive that way. The next thing is insurance. Dental insurance doesn't really cover very much, you know, $1,000 to $2,000 a year. It's very minimal, you know, if that.
What about Medicare and Medicaid?
Medicare and Medicaid, no.
They don't really cover it.
They don't really cover anything. Medicaid won't pay for dental implants almost, period. You know, Medicare, just very little, you know, so that affects it a lot.
But people finance this.
People finance this. 80% of people across the country who get this procedure are financing it through third parties. Okay. The next thing is materials. Like anything, there are cheap materials and then there are really good expensive materials. The materials that we utilize are the best. We replace that full set of teeth with zirconia teeth. And this is the material that doesn't stain. It's beautiful. It doesn't crack, chip, and it lasts, you know, as long as you, hopefully, right? As long as the patient. Warranty and maintenance. We have a wonderful warranty on our full set, our full arch of dental implants, those teeth. We have a wonderful warranty, lifetime warranty on that full set of teeth. Maintenance, we see you every 6 months. The next thing that affects the cost is what kind of teeth they're really getting. Sometimes a Google ad can be a little bit misleading, and patient might think that they're going to be getting some teeth that are fixed that don't come in and out of their mouth, when they're really going to be getting something that snaps in and snaps out.
So like a snap-in denture.
That's right, a snap-in denture, which has its place, you know, but, and we do those for patients as well. But what we're trying to get you into is something that's much better than that, and it doesn't come in and out of your mouth. Okay. And then experience and training. I have a tremendous amount of experience. I've worked in offices that are, you know, the leading offices in the area as far as how many of these we do, you know, each week and each month and each year. I've gone across the world to several different countries for training and learning new techniques.
So the goal is to get it done right the first time.
That's right. We want to get it done right.
Expensive.
It's the least expensive way. Do it right the first time. That's right. And that's why it's not that simple. When somebody calls in and asks what the price of it is, you have to come in. We have to have you come in.
Because there's a lot involved.
There's a lot involved with what it is that we're going to actually end up doing for that patient.
But they get a quick price.
They can, yes.
From the time they walk in the door, they'll have like a treatment plan in writing.
That's right.
Okay.
At the end of the first appointment, about an hour-long consultation, they'll have a treatment plan that has the different prices listed out.
And you say you're less than 30, about 30% less than
30
big
to
guys?
40, you know,
Really?
even more in some cases. You got it.
Okay, good.